Community Dialogue, a segment of Community Convener, where we bring business and community leaders together to talk about what truly moves Henry County forward. Thank you to our 2026 sponsor, Kaiser Permanente, for supporting conversations that strengthen workforce, leadership, and community health. February is Black History Month, and today we're focused on the foundation, specifically the business case for engagement and inclusion. This conversation is about shifting the narrative from the right thing to the smart thing. Our guests today are Tony Carnell, General Manager of the Henry County Water Authority, and Thomas Williams, Government Relations and Local Affairs with Kaiser Permanente. Welcome, guys. Tony, can you tell us a little bit about Henry County Water Authority?
So Henry County Water Authority is an organization that's set up. We provide water sewer services for all unincorporated areas, and we serve water to portions of the incorporated areas of all the cities in the county. We have approximately 300 employees. We have 2 water treatment plants and 3 wastewater treatment plants. Our board is appointed by the Board of Commissioners of the county. We have 6 board members, and the board members appoint me as general manager. And so we provide those services, and we plan for 30 years out each time to make sure we have enough water sewer to serve future populations of the county.
Thank you, Tony. Thomas, tell us a little bit about Kaiser Permanente.
Yes, thank you for having me. Kaiser Permanente is the country's largest integrated healthcare organization. We have about 76,000 nurses, 25,000 physicians, 243,000 employees. We're located now in 9 states across the country. We have over 40 hospitals and over 600 medical centers. Here in Georgia, we have 26 medical centers, over 3,000 employees, and thank you for having us on the program today.
Thank you. I'm glad to have both of you here. So let's get started. And I just want to get a quick take from both of you. In one sentence, how does having a diverse leadership team impact your bottom line?
Togetherness, I think having a diverse culture, I think it affects our bottom line. We're able to provide much better customer service.
Okay. How about you, Thomas?
And with Kaiser Permanente, it really helps promotes our bottom line with being able to address the social determinants of health. As we know, healthcare is something that everybody does not have access to. So when you have diverse leaders at the helm of the organization, it means that they are attentive to those social determinants of health and try to address them holistically.
Okay. Thank you. Tony, as general manager of the Henry County Water Authority, you lead a complex organization that serves the entire community. How does leadership diversity influence decision making, risk management, and long term performance in a public utility?
Well, when we talk about leadership, I'm going to start with my board. When I was appointed general manager, one of the tasks was to improve diversity, and it takes having a board behind you to support you in being able to launch and support different programs. And one of the programs that our board was pretty persistent on when I started out was having a supplier inclusion policy and policies to support local, small, diverse businesses. So I think, from that aspect, it changed the way that I make decisions and our team as far as how we communicate, how we involve the public, and those programs lead on to other programs. Like to our students, we have different programs from kids, kids fishing day, we have internship programs, and we have a citizens academy and things like that. So basically knowing the tone that the board sets basically helps me to set the tone of the organization. It kind of forces you to look at your purchasing policies, look at your hiring practices and day-to-day operations. And so that's how it's kind of helped me as far as some of my decision making in our long-term performance.
Where have you seen engagement and inclusion directly improve the outcomes?
I think we're starting to see it in our succession planning. We've got programs, 3rd graders, 9th and 10th graders, 11th and 12th graders. 11th and 12th graders, that's the internship partnership that we have with Southern Crescent Technical College. We've seen those kids come through. We teach them interview skills, teach them how to fill out a resume. They learn different parts about the authority. And initially, it was pretty tough getting our employees or managers to accept the buy-in of bringing students in. So after we got some of these students and seeing what they do, some of in our SCADA program, supervisory control and data acquisition, the electrical control systems, some of the students coming out of the school made our management team, they were really impressed by them. So from that, we've hired, I believe, 2 full-time, and we've got 2 part-time and some seasonal students that come back each time. So what I'm starting to see is these programs that we've started is basically the participation rate. The minority is the majority is probably about 70%. It's basically a makeup of the school system. So what we're starting to see is some of those students come into the work program, and also some of our hiring practices. We redact certain information from people applying for jobs here. By redacting the information, there's the unconscious bias that managers, supervisors may have in selecting who they interview. That information is redacted, and they don't realize who they're hiring until the day before the employee shows up, and they go through the interview, and it's really changed basically the diversity of our applicants coming into the workforce. And what people are looking for mostly is fairness, and people here that work here and people outside of here, I feel like there's a different level of respect from as far as our hiring practices. Everyone wants the same equal chance, and so we try to give everyone a chance, and we're deliberate about where we advertise our positions, how we go about advertising our positions, and so it has really helped us. And then just basically the culture, we don't just practice our culture, we communicate our culture, and I think we communicate that culture by having a diverse makeup, and it tends to make people want to come work for Henry County Water Authority. And I think in the end, financially, the retention rate, it has helped us when you onboard an employee. It costs a lot of money to onboard an employee, so you don't want a lot of turnover. So I think financially, it has helped us with our retention rate and employees, and we have a very small turnover rate.
Great. That sounds great. Thomas, Kaiser Permanente operates at the intersection of workforce, health, and community well-being. From your perspective, why is engagement and inclusion not just a values conversation, but a business strategy?
Thank you. That is a profound question, because as the country's largest healthcare organization, and by Kaiser Permanente being a provider of healthcare and healthcare insurance as well, having that integrated healthcare delivery service is so important. However, Kaiser Permanente has been on the cutting edge of actually small business growth and small business development, and particularly in women-owned and minority-owned firms. Since our inception, 1945, we have always had a practice of inclusion. And so that really positioned Kaiser Permanente some years ago to help to start an organization called the Billion Dollar Roundtable. Billion Dollar Corporate Roundtable is an organization that makes a commitment each year to do $1 billion of small business contracting with all minority-owned firms, women-owned, Hispanic-owned, veteran-owned firms, disabled veteran-owned firms. And it has been a great program that we do. And it's part of our contracting also. This is where we make the most impact. We require 31% of our contracting opportunities to go to those small businesses. And that has really changed the trajectory of a lot of businesses that want to get into the construction area arena. And we're very proud of that. And bringing it closer to home to Georgia, we recently, we're about to complete a $50 million complete renovation of our Cumberland medical office building on 285. That was a $50 million project. That project was awarded to a woman-owned construction firm, Leapley Construction, here in Metro Atlanta. And that also was the largest award throughout the enterprise right here in Georgia to a woman-owned construction firm. And then that woman-owned construction firm works with other women-owned businesses and minority-owned firms at that 31% to help them. So when we look at the quote by John F. Kennedy that says, "A rising tide lifts all boats," that is very true. And that's something that Kaiser Permanente is committed to, is to not only providing the tide, but also providing the tools and the boat in order to make small businesses sustainable.
Right. One of the things that just kind of comes to mind with this whole thing, both the Water Authority and Kaiser Permanente, the strategies that you both have talked about are very fair and equitable strategies and doing good really for all. So, Thomas, just kind of a little follow up with your strategy because you partner locally and you invest in communities like Henry County. How does that strategy show up in how you partner locally and invest in communities?
Great question. We are very proud of our affiliation with the Henry County Chamber of Commerce. And in doing so, Kaiser Permanente donated $30,000 in the form of an equity opportunity grant to the Henry County Chamber of Commerce Foundation. And the purpose of that grant was to create a program, which they created the mentoring program that could help women-owned and minority firms become stronger. And the mentoring program, actually, some of our colleagues on the board served as mentors. And we're very happy at the results of the first cohort. The first cohort had 10 members, and all 10 members of the cohort were women-owned firms. And that certainly by circumstance, but the Small Business Administration says that over 90% of new small businesses are owned by women. And that's something that we truly respect and recognize. And we congratulate the Chamber on graduating the cohort last week at the Chamber annual dinner, and we were honored and proud to present them with a certificate. Also, those businesses that were impacted, those women-owned businesses that were impacted, it actually changed the trajectory of their companies, and they're doing much better because of the mentoring program. In addition to that, those 10 organizations, small businesses, that cohort created their own ecosystem. So now they're talking amongst each other. They're talking about each other's challenges. Now that's an ecosystem that exists in Henry County that did not exist before. So we're thankful to the leadership of Joe Henning and the board in establishing this program, and Judy McMurtry and doing a great training for the mentors as well. That was required, that the mentors had to be trained in order to be a mentor to the mentees. So we're excited about this partnership, and we're just looking forward to greater things happening as it relates to that.
Yes, the mentorship program has been great, and I've enjoyed getting to know just about everybody that went through the program. So, well, let's shift a little bit and let's talk about inclusion because inclusion has been framed as something businesses should do. What changes when leaders ask, how does this make us stronger, smarter, and more competitive?
I cannot imagine operating without a substantial amount of inclusion. We have what's called the EUM group, Effective Utility Management Groups, and there's a framework that was adopted by the American Water Works Association, American Public Works Association, and some more national affiliates associated with public works. Basically, by adopting that criteria, it helps you to become more effective run utility. So on our committee, it is made up of not just managers and supervisors. It is made up of our field personnel, our customer service representatives, and they all set the goals for the authority each year. So you may have someone on a committee who's not in a manager supervisory role, but they do have some influence on the goals that we set forth for the year. And the appreciation and the morale that this brings to the company, to the organization as a whole is just monumental. And additionally, with inclusion, it's really communication kind of go hand in hand. So my management team, we meet monthly. My executive team, we meet monthly, and we talk regularly. I mentor mentee programs. I'll do a breakfast probably twice a month with certain managers, supervisors, any up and comers, and basically just communicating the culture and the expectations. Anytime I get an opportunity to talk to our employees, whether it's at our internal leadership academy or if it's new employee orientation, just communicating the expectations and letting them know that they're included, they're part of this organization. Any volunteer events we have, like our Kids Fishing Day or Kubahachi Kids, where employees can volunteer, is part of our culture. Once you include your employees into what you're doing and into your culture, I think they become the advocates for the authority. And not only do they become the advocates, the community becomes the advocates when they get out in the community and we share these stories of the things that we do. So that's my thoughts.
What about you, Thomas?
Inclusion is critical in healthcare because of cultural differences and the lens that different cultures see things. And so for Kaiser, it has always been where we want every aspect of our community to be at the table. And as we know in healthcare, that is so important because that drives how we deliver healthcare in our communities. So the mission of Kaiser Permanente is to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. So that mission is very important to our leadership. And inclusion is just an aspect of what we do day in and day out in our effort to improve the health of our communities.
So, what is one tangible action that organizations of any size can take to build more engaged and inclusive leadership teams?
Never forget about your people. Don't undervalue your human resources. And the analogy I like to use here is we've got two resources. We've got water resource and we got human resource. That water is no good sitting out in the lake, in the reservoir without the human aspect of it. Our people is what make it happen. Our people are responsible for making that resource what it is. It's similar to Chick-fil-A, their great customer service and their great product. That product without the people doesn't mean anything. So my suggestion is, just never underestimate the value of your people and show them appreciation regularly.
I agree completely with Tony. And one of the things that Kaiser Permanente we're very proud of is our ability to support the community. And with that, as of recently, as of January the 6th, we were able to partner with Dr. Pace in the school system and to provide access to free training, mental health first aid training for all 60 of the school system's social well behavioral specialists. And that training and certification is the top of the line. And we're very proud of that. We're very proud of our partnership with Chair Kalada Harrell of the Board of Commissioners being the presenting sponsor of the inaugural Senior Gala last September, and to allow seniors to have a good night and something to look forward to and to come dressed up in the Great Gatsby theme. So that was so rewarding and so fulfilling. Also, too, we're working in partnership with Chair Harrell and the Board of Commissioners on the inaugural Valor Awards, where we take time and pause and honor public safety, 911, first responders, police and sheriff departments for their heroism and what they're doing in our communities to protect and serve. So we're very proud of our partnerships with local governments and county governments to lend our support whenever we can.
Thank you. Yes, Kaiser Permanente and the Water Authority do a lot in Henry County, so we're very, very thankful in the county for both organizations. For business leaders that are listening to this today, engagement and inclusion are not add-ons, but they're foundational. Thank you to our guest for sharing how smart leadership choices create stronger businesses and communities. And thank you to Kaiser Permanente for supporting conversations that help Henry County move forward.
Thank you. Thank you
Thank
so
you for
very
having
much.
us.
Thank you for having us. I would like to say that what really drives people like me and Tony in what we do, I'm reminded of a quote by St. Augustine, and he once put pen to pad and said, "Hope has two beautiful daughters. Their names are anger and courage. Anger at the way things are, and the courage to see that these things do not remain as they are. This is a challenge of a lifetime." So the work that we're doing with the Henry County Water Authority and Kaiser Permanente and other organizations, it takes courage to do it. And I want to thank the Chamber, thank you, Christy, and the Chamber Board and leadership and Joe and his team for having the courage to lead in this community. Thank you so very much for having me.
Thank you.